Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I'm a district activist leader and trustee for the National MS Society. I also chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering those questions and connecting you to resources. Before we get started, I want to acknowledge and thank today's contributing national sponsor, ANI Pharmaceuticals. Support from MS community partners helps the National MS Society reach its goal of providing up-to-date information and support through programs like Ask an MS Expert. Spasticity is a common symptom of MS that can interfere with walking, movement, speech, and many other activities of daily living. Dr. Michelle Cameron is with us today to help us understand what spasticity is and to share some strategies for managing spasticity. Dr. Cameron is a neurologist and physical therapist, a professor in the Department of Neurology at Oregon Health and Science University, interim chief of neurology at the VA Portland Healthcare System, and co-director of the VA MS Center of Excellence West. Welcome, Dr. Cameron. Thanks for joining us today.
Thank you, John. It's a pleasure to be here.
Well, I guess the best place to start is right at the beginning. What exactly is spasticity, and how common is it among people living with MS?
Good question. Exactly. We better define our terms. So spasticity is really a tightness or a stiffness of the muscles, and often comes with painful contractions or muscle spasms, involuntary movements of the muscles, and these can either bend the limbs or straighten them out, but these movements happen without control of the individual. So the muscles just move when they don't want them to, or when they do want to move, the muscles are stiff and tight and hard to move. And about 80% of people with MS do experience some form of spasticity.
Do we know what causes spasticity? And I think you've already started to answer the second part of my question. How does spasticity affect someone?
So what causes spasticity is the damage to the nerves of the brain and spinal cord that we know MS does. I mean, MS is primarily a disease of the brain and spinal cord. When that's damaged, instead of the brain and spinal cord finally controlling muscle contractions and often actually dampening them, those muscle contractions are without control or inadequately controlled. So the muscle starts to move or the muscle gets stretched, and then it just moves excessively. The impact it can have, so it usually affects the legs more than the arms. And when it does that, this can cause obviously difficulty with controlling your own movements, but it can cause pain or discomfort. And if you don't control your movements well, this can affect your ability to walk safely, your balance, your mobility. This happens during the night. It can actually wake people up from sleep. And sadly, it not only wakes the person with MS, as you said, your wife had MS for many, many years, it can actually affect the bed partner. If their legs start kicking, they kick the person who might be with them. And then if it does affect the arms and the hands, it can affect the ability to do things like writing, feeding oneself, dressing. And not surprisingly, that impact then gets more broad and can affect people's mood, their quality of life.
And what happens if spasticity is left untreated?
So I think this is sort of a nuanced answer, actually. If spasticity is mild, it's often just fine to leave it untreated on the basis that we mostly treat it with medications. We'll get to that a little later. Those more medications has the risk of more side effects. So mild spasticity is often left alone. But when it starts to impact somebody's quality of life, their ability to do things safely, we can start to see, as I say, problems with quality of life. If we don't treat it, we can see falls, we can see trouble with self-care. We can actually, if left alone for long enough, it's thought that this contributes to contractures, which is basically the muscles are tight, and if they stay that way for long enough, then they get stuck in that shortened position, and the joints get stuck in those shortened positions where they can't be moved.
Well, as unpleasant, uncomfortable, and even painful as spasticity might be, are there any potential benefits to spasticity?
There actually are, and it's a good point. I think sometimes we think, oh, if it's a symptom of MS, it must be all bad. But we know that, as I said, spasticity is mostly in the legs. It can happen when the legs are weak. And if your legs are weak, they can be hard to stand on. You can't get enough contraction. Actually, the spasticity itself may provide some support to help hold you up for mobility. So it's a fine line of, you don't want to treat spasticity so much that then your muscles get flimsy and weaker. So some amount of tone or contraction in the muscle is actually helpful. It supports you.
Well, we heard from Carrie, who said she can't bend her leg like she used to. And Carrie wants to know if her doctor can do an assessment to determine if this is spasticity or is it something else?
Absolutely. So I think in this COVID or post-COVID era, it's important to realize that the doctor can do an assessment, but we really can't do that assessment virtually. We actually have to touch you and move your legs around if this is your leg. So it'll require an in-clinic exam. Once you're in the clinic, we'll do a variety of things. First of all, we'll probably know that the reflex hammer will tap out your reflexes. And usually the reflexes are extra jumpy together with spasticity. So that's a sign that this is probably spasticity. And then we'll actually move your leg, and we'll move it at different speeds, slowly and then quickly, to see if it resists. Spasticity resists most when you try to move fast, actually. So if we try to move your leg very slowly, probably be able to bend it. But if we try to move it quickly, it'll become a lot more difficult. And that will help. We'll also want to be sure that we're not dealing with weakness, and that's why you can't bend your leg, because the muscles that bend it are weak, or that you're having trouble bending because of something we call ataxia, which is you can move, but you can't move where you want to. That control of the movement in the right direction can be impaired. So we will take a close look, tap out the reflexes, move you passively, test your strength, and look at your voluntary attempts at movement to try and understand if this is spasticity or something else.
Juanita wrote in, and she's wondering what she can do to lessen the likelihood of experiencing spasticity. Are there triggers that might actually make spasticity worse?
So there's really sort of two levels of answer to this. I think the first level is, what can you do to lessen the likelihood of experiencing any MS symptom, both now and more importantly in the future? And that's really work with your provider around disease-modifying therapy. And that's really to protect you from what might come later. As we know, we have a wealth of disease-modifying therapies to help slow down MS. And so that's sort of the first piece of the solution. And then there's, okay, you have spasticity. It fluctuates. Sometimes it's better, sometimes it's worse. So are there things you can do to keep it calm in the now? And there are a variety of things you can do for that. Often looking for yourself for triggers. For many people, this can be extremes of temperature, usually cold, actually. Will tend to cold weather, but also extremes of heat. Sudden movements. So as I said, moving the muscles quickly will bring out spasticity. Moving them more slowly will not. So trying to avoid sudden movements. Certain positions may bring it out. Fatigue, stress, pain, a full bladder or bowel, infections, and quite commonly infections that don't seem like they're related. It's like, why are they checking me for a urinary tract infection when I say my legs won't bend? Urinary tract infections can make all MS symptoms worse. And sometimes even tight clothing can make spasticity worse. So quite a range of things, if you have spasticity, can actually aggravate it, irritate it. And then, as I said, remember your disease-modifying therapy to try and not let the disease itself keep coming.
Strategies to treat or manage spasticity can include exercise, medication, devices, changes in daily activities, or your healthcare provider may refer you to a physical therapist or occupational therapist. Now, before we talk about some of these strategies, can you tell us what the goal of treatment is when it comes to treating spasticity?
Sure, John. Excellent point. And I think this brings up often an important point in treating any symptom of MS. Really, the purpose of treating the symptoms of treating spasticity is to make your life better. So if spasticity is interfering with your daily activities, if it's interfering with your sleep, your ability to walk, the goal of the treatment is to make that better, to have less interference with your daily life from this symptom. And obviously also not to replace that problem with a second problem with a side effect. So we're trying to reduce the negative effects of spasticity on you and minimize your sort of paying for that with something else. So we'll have some therapies that are really just trying to reduce the spasticity. There will be treatments that focus on working around it. So is there a different way to do an activity? And then lastly, to avoid serious complications, like we talked about, contractures, those muscles tightening and being stuck that way. And so we're certainly, by controlling spasticity, trying to prevent long-term complications of having it.
Marissa tells us that she's read conflicting information about stretching. She's read that it's good for spasticity, but she's also heard that it can trigger spasticity. What would you tell Marissa about the importance of stretching as one way to help manage spasticity?
So I think let's deal with this conflict of, is stretching good or is stretching bad or a trigger? So as I've mentioned a few times here, fast movements can trigger spasticity. So as we look at stretching, it's important to do it slowly. So if you quickly move the arm and it has spasticity, it'll just bounce back and pull. You need to move it very slowly. So slow stretching may be helpful. Fast stretching is likely to be a trigger. When we look at slow stretching, this has certainly been considered the first line of management of spasticity for many, many years. And this is because if you think that the muscle tends to shorten, it seems logical that if we try to lengthen it, that would help. It's a little tricky for me to promise you that will work. That's the only tricky piece, which is we don't really have good data or evidence to show us that stretching is helpful But I would say that most patients find that it is or say that it is, and that doing so consistently on a daily basis is the most helpful. So I think it's certainly something people should try. Stretch slowly, try it for a while and see if it's helpful for you. But don't feel, if you tried it for a while and didn't seem to help at all, don't feel guilty that you aren't doing it. We've all got lots of shoulds. I don't want to dump more shoulds on you when I don't have clear, definitive proof that it works.
Well, let me ask you, are there other exercises or physical activities that can be helpful in managing spasticity?
So most people find that movement helps. As the phrase I was always taught is, motion is the lotion. So keep moving. And you may find something that you like to do. And some people like stationary bicycling. That can be very relaxing. Doing yoga is often slow movements and tends to be stretching. Aquatherapy, so being in the pool, again, can be a very comfortable environment for some people, although others will say getting there, getting in, getting out, getting changed, not worth it for me. So it's not like it's got to be one exercise, but activity, moving your limbs is helpful, and things that move your limbs through their full range may be the most helpful in keeping the muscles stretched out.
Well, we heard from Jacob, and Jacob told us that his doctor recommended a medication to help with his spasticity. He wants to know if this particular type of medication is safe and effective. So can you tell us which medications are typically used in managing spasticity?
Great, thank you. Yeah, I mean, there are really a variety of medicines that are used. Most commonly, we start with baclofen, and this is a medication people take once or twice a day. And at first, they'll start with a low dose and then gradually add a little more until it works. And as long as it works and doesn't make people too sleepy. Often this medicine makes people sort of drowsy and sleepy. It's also often why we say, well, try just taking it at night and see if that's sufficient. So that's usually the first line of treatment. The next sort of medication is tizanidine, and often people take both baclofen and tizanidine. Again, this medication can make people sleepy, but sometimes you can find a sweet spot by mixing the two that keeps you alert enough and helps to control the spasticity. And then the most common sort of last oral medication that we use are what we call the group of benzodiazepines. So this is Valium or clonazepam. So it's a group of medicines. These have substantial risk associated with them. They can make you very drowsy. They can slow your breathing. Definitely to be used with caution. But certainly work directly with your doctor to find the right mix. As I said, these all tend to work. Whether they work well enough at a dose you can tolerate varies. Most people get sedated, so sleepy at the higher doses. And then another option, a couple of other options that can be used. One of them is actually injections of botulinum toxin directly into the muscles. So this can work quite well if it's specific muscles. It's not going to work for your whole body. You do have to repeat it about every 3 months because it wears off. This is a good and a bad thing. If it helps you, we can keep doing it. It's a pity it doesn't last forever. But if it didn't go well, it will wear off and go away. And so that's an option for people. And then baclofen pumps are occasionally used. That's a pump that actually bathes your spinal cord in baclofen. So you need a lot less baclofen. It doesn't get all over your body to get it to the nerves that are affected, that are giving you spasticity. So at first glance, it sounds like a great option. Just put it where it needs to be. The problem with baclofen pumps, you need surgery to put it in. You need to get it filled. You've literally got little hoses running through you now that are pumping the baclofen from the source, the pump, to the area around your spinal cord. And those can get kinked, they can get infected. So we do use them occasionally, but they're tricky to manage and are definitely one of the later options with some substantial pros and cons. So I think what you see here is really a wide range. We said spasticity varies a lot, from very mild to more severe. Our treatments also have a very wide range, from just stretching to these medications, and the medications can sort of add on over time if needed.
You mentioned botulinum toxin injections, and we heard from Rose, who wants to know whether this is the same stuff that people use on their faces to reduce wrinkles. Rose wants to know how that could possibly help with spasticity.
Great question, Rose. And yes, it is exactly the same stuff people use on their faces to reduce wrinkles. So when they use it on their face to reduce wrinkles, basically what they're doing, the toxin stops muscles contracting. So wrinkles to some extent are formed because we move our faces and thus keep crunching different parts, and that makes wrinkles. So if you inject botulinum toxin into areas of your face, they can't crinkle up, they can't wrinkle. Now we take that same thing that stops muscle contractions and we inject it into your leg that keeps contracting when you don't want it, and you're, who knows, kicking your husband in bed at night when you weren't planning to. If you can stop that muscle contracting without control, that will help with spasticity. So it's really working the same way. It's preventing or weakening a muscle contraction.
Earlier, you mentioned that heat and cold can be triggers for spasticity, but temperature therapy can also be beneficial in treating it. Can you explain how temperature therapy works?
Somewhat, again, it's one of those things we don't fully understand. If you just get the muscle cold very briefly, that will tend to actually make spasticity worse. The muscle will contract. But as the cold is there for longer and longer, the nerves actually can't conduct very well when they get really cold for a long time, and so gets less sensitive, and the spasticity will go away, although only briefly, so an hour or so. This can be helpful if the therapist wants to stretch your muscles. They could cool them for a long time and then stretch them. So that can be helpful. And heat can just be relaxing for people as long as there isn't too much. It's not too hot, and can then ease some spasms.
We've talked about some things that people can do to manage spasticity, but another approach involves assistive devices, splints, and braces. Can you talk about how these tools might help someone?
So these are sometimes used after we've used botulinum toxin, so we weaken the muscle, but now we need to help it. So we might use a brace. You may also find that you've got spasticity of one muscle, and so that's getting in the way of the muscle on the other side contracting. So I'll give you an example. Some people, when they try to walk, their toes keep catching. And their toes are catching in part because the muscles that lift their toes are weak from their MS. They're also catching a little bit because the muscles that bring their toes down are having some spasticity, the ones that pop you up on your tiptoes. And so if you put a brace behind the leg and under the foot, that actually helps to lift the foot up and stop the foot from catching. That's called an ankle foot orthosis, or an AFO. So that can be helpful. There can even be devices that use electricity to essentially do the same thing. So those can be helpful. And then there's also assistive devices like canes and walkers, crutches. So if you're finding that your spasticity is making you off balance, as I said, we can do things to treat the spasticity directly or sort of work around it. And working around it is to give you better support. So if your spasticity sometimes tries to knock you off balance, one of these walking aids can help keep you up, or just get you back in the right direction. So a variety of different approaches depending on what brace, splint, or device you're using. But a lot of different things can be helpful. Splints can also be particularly helpful for the hands. If you're having trouble having good control, they can also position the hands to give you a little bit more function.
How can a physical therapist or occupational therapist help someone with MS who's experiencing spasticity?
So all sorts of different ways. They may, together with your physician provider, assess your spasticity. So really try to hone down back to where we started. Hey, I'm having stiffness in my leg, or I'm having trouble moving my leg. Really do a very thorough assessment to figure out what's spasticity, what's weakness, what's ataxia, why are you having the trouble either moving your leg or walking safely? What are the contributors? It may be all spasticity, it may be spasticity and some other pieces, to figure out what's contributing. After that assessment, they'll start with treatment. And that treatment may be teaching you stretches. So how do I do? It's easy for me to say here on a video, stretch your muscles, stretch them slowly. But what muscles? How exactly do I do that? How do I do it safely? How many times should I do it? How hard should I push or pull? Is it working? What effects should I see? So really going through the logistics of doing stretches and doing them the right way and assessing if they're helpful. And then the therapist can also work on your safety, your mobility, the devices we just spoke about, so splints and braces, other forms of exercise we spoke about. So really taking you through from that initial assessment, what do I think is going to be most helpful for you as a physical or occupational therapist, how to actually execute that, stretches and other exercises, using various devices, and then reassessment. Is this working out for you? Is it helping? And is it practical for you to do? So that constant back and forth between you and the therapist to come up with the best solution. But as we said, like all our treatments is working to improve your quality of life.
Well, you've shared some great strategies for managing spasticity. What would you say are the top 3 takeaways that you'd like our viewers to remember?
So I think the first one is just, if you think you have spasticity, talk to your doctor about it. Hey, I'm having trouble bending my leg. Do I have spasticity? Is it something else? Number 2, consider seeing a physical therapist if you think you have spasticity. As I said, they will not only go through that assessment, but come up with a wide range of non-medication treatments that might be helpful. And then I think number 3 is the somewhat, as one says often, be patient. Be aware it can take a little time to get the management of your spasticity optimized. And this will likely be a combination of exercise, medications, activity modification. And it's unlikely you'll be so lucky as to go to your doctor and get just the right medicine that works at that dose perfectly for you. And that physical therapist one time and the OT one time, and they come up with a perfect exercise. This is really a back and forth between you and your providers to get the best solution for you. So number 1, speak with your doctor. Number 2, speak with a physical therapist. And number 3, be patient to work with those people to get the right combination for you of those exercises, medications, and activity modifications to keep your spasticity not messing with your life.
Well, I want to thank everyone who submitted questions, and thank you for being with us today, Dr. Cameron.
You're welcome. Thank you. Thanks for the opportunity.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups. You'll find out about ways that you can become involved, and you'll hear about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Cameron for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Michelle Cameron and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.